Which of the following is not a vital signs? Option A, pulse rate. Option B, respiratory rate. Option C, blood sugar level. Option D, blood pressure. The correct answer is option C, blood sugar level. Vital signs include temperature, pulse, respiration, and blood pressure. Blood sugar is important but not a vital sign. Blood sugar level is not a vital sign. The normal body temperature in Celsius is option A 36 degrees Celsius, option B 37 degrees Celsius, option C 38 degrees Celsius, option D 39 degrees Celsius. The correct answer is option B 37 degrees Celsius. The average normal body temperature is 37 degrees Celsius, that is 98.6 degree Fahrenheit. Normal adult pulse rate ranges from between option A 40 to 60 beats per minute, option B 60 to 100 beats per minute, option C 100 to 120 beats per minute, option D 30 to 50 beats per minute. The correct answer is option C 60 to 100 beats per minute. A healthy adult pulse rate lies between 60 and 100 beats per minute. The most common site to measure pulse in adult is option A brachial artery, option B femoral artery, option C radial artery, option D carotid artery. The correct answer is option C radial artery. The radial artery at the wrist is the most accessible and widely used pulse rate. Radial artery is the common site to measure pulse in adults. Radial artery at the wrist. The normal respiratory rate for an adult is option A 10 to 12 breaths per minute, option B 12 to 20 breaths per minute, option C 20 to 30 breaths per minute, option D 80 to 10 breaths per minute. The correct answer is option B 12 to 20 breaths per minute. A adult respiration rate is 12 to 20 breaths per minute. The normal systolic blood pressure for an adult approximately option A 120 mm of Hg, option B 100 mm Hg, option C 130 mm of Hg, option D 140 mm of Hg. The correct answer is option A 120 mm of Hg. A normal adult systolic blood pressure averages 120 mm of Hg with diastolic 80 mm of Hg. Which thermometer is used to measure body temperature through the ear? Option A digital thermometer, option B mercury thermometer, option C tympanic thermometer, option D glass thermometer. The correct answer is option C tympanic thermometer. A tympanic thermometer measures temperature through the ear canal reflecting core temperature. The pulse felt on the neck is called option A carotid pulse, option B radial pulse, option C brachial pulse, option D femoral pulse. The correct answer is option A carotid pulse. The carotid pulse located in the neck is used especially during emergency to assess circulation. The pulse felt on the neck is called carotid pulse. Which factor decreases the pulse rate? Option A exercise, option B hypothermia, option C fever, option D pain. The correct answer is option B hypothermia. Hypothermia reduces metabolic activity and heart rate, lowering the pulse. Hypothermia decreases the pulse rate. Reduce the Which of the following vital signs is affected first in shock? Option A blood pressure, option B respiration, option C temperature, option D pulse. The correct answer is option A blood pressure. In shock, blood pressure drops early due to poor tissue perfusion and low cardiac output. Blood pressure is the first vital sense. The normal diastolic blood pressure for an adult is option A 60 mm of Hg, option B 70 mm of Hg, option C 80 mm of Hg, option D 90 mm of Hg. The correct answer is option C. A healthy adult's diastolic pressure usually averages 80 mm of Hg, representing the pressure when the heart rests between beats. Normal diastolic blood pressure for adult is 80 mm of Hg. The instrument used to measure blood pressure is called option A thermometer, option B stethoscope, option C spirometer, option D sphygmomanometer. The correct answer is option D. A sphygmomanometer is the medical instrument used to measure blood pressure, often with stethoscope. The instrument used to measure blood pressure is The normal temperature ranges in Fahrenheit is option A 95.4 to 97.0 degree Fahrenheit, option B 98.4 to 99.5 degree Fahrenheit, option C 97.0 to 99.5 degree Fahrenheit, option D 96.0 to 100.5 degree Fahrenheit. The correct answer is option C. The normal. Which of the following increases body temperature? Option A starvation, option B sleep, option C exercise, option D cold exposure. The correct answer is option C exercise. Exercise increases metabolism and muscle activity, leading to a rise in body temperature. Exercise increases the body temperature. The apical pulse is located option A in the wrist, option B over the carotid artery, option C on the chest below the nipple, option D behind the knee. The correct answer is option C on the chest below the nipple. The apical pulse is found at the fifth intercostal space just below the left nipple line head using a stethoscope. The pulse rate is best assessed for 1 full minute when option A patient is awake, option B pulse is irregular, option C patient is resting, option D patient is asleep. The correct answer is option B pulse is irregular. When a pulse is irregular, it must be counted for a full minute to ensure accuracy. Pulse is assessed best when it is irregular. Which artery is commonly used to measure blood pressure? Option A radial artery, option B brachial artery, option C carotid artery, option D femoral artery. The correct answer is option B brachial artery. The brachial artery in the upper arm is the standard site for measuring blood pressure using a cuff. Brachial artery is commonly used to measure blood pressure. Which factor increases pulse rate? Option A hypothermia, option B sleep, option C fever, option D hypoxia. The correct answer is option C fever. Fever rises body metabolism and oxygen demand, increasing pulse rate. Fever increases pulse rate. Rises the normal temperature in axilla armpit is usually option A 37.5 degrees Celsius, option B 36.5 degrees Celsius, option C 38 degrees Celsius, option D 35 degrees Celsius. The correct answer is option B. Axillary temperature is about 0.5 degrees Celsius lower than oral temperature, averaging 36.5 degrees Celsius. The pulse rate in a newborn is usually option A 60 to 100 beats per minute, option C 70 to 110 beats per minute, option C 80 to 120, option D 120 to 160 beats per minute. The correct answer is option D. A newborn's pulse is much faster, ranging between 120 and 160 beats per minute. The normal respiration rate in a newborn is option A 10 to 20 breaths per minute, option B 20 to 30 breaths per minute, option C 30 to 40 breaths per minute, option D 15 to 25 breaths per minute. The correct answer is option C 30 to 40. A newborn normally breathes 30 to 40 times per minute, which is faster than adult due to higher metabolism. Which of the following is a sign of bradycardia? Option A pulse rate 100 beats per minute, option B pulse rate 80 beats per minute, option C pulse rate 60 beats per minute, option D 50 beats per minute. The correct answer is option D. Bradycardia means slow heart rate, generally below 60 beats per minute in adult. Which of the following is a sign of tachycardia? Option A pulse rate 40 beats per minute, option B pulse rate 60 beats per minute, option C pulse rate 90 beats per minute, option D pulse rate 120 beats per minute. The correct answer is option D pulse rate 120 beats per minute. Tachycardia is defined as pulse rate over 100 beats per minute in adult. The normal range of oral temperature. Option A 35 to 36 degrees Celsius, option B 36 to 37.5 degrees Celsius, option C 37.5 to 38.5 degrees Celsius, option D 35.5 to 37 degrees Celsius. The correct answer is option B. Oral temperature normal ranges between 36.5 to 37 degrees Celsius. Which of the following is not a factor affecting body temperature? Option A, exercise. Option B, age. Option C, gender. Option D, environment. The correct answer is option C, gender. Temperature is influenced by age, activity and environment, not by gender. Thank you.